So what is a cervical exam and why are they used? A cervical exam is used to identify a few things. Number 1, your baby's station. Where is your baby in your pelvis? Number 2, your baby's position. Number 3, dilation. And number 4, effacement. Let's break down what all of those pieces are. So the first one is station. Station refers to how deep your baby is in your pelvis. There is -3 station, where the baby is floating above the pelvis. Then there is 0 station, where the top of the baby's head reaches the ischial spines right here. And then there is +3 station, when the baby turns and they're about at crowning. So your baby travels from -3 station to +3 station. I have seen -5 to +5. More often I hear of -3 to +3. This is really helpful information to have if you're in labor, because if we find out you're in active labor, but baby is -2, maybe we could do some things to help open the pelvic inlet where baby goes in. If we find out that baby is deep in the middle of the pelvis, we can do some things to open the mid-pelvis, like some lunges to create more space where the baby is. And if baby is nice and low, we can do some things to open the outlet where baby goes out. Your body will guide you and tell you where to move. So it's important that we aren't stressing about doing the right positions. But I've also found that when it comes to cervical exams, the most helpful information we can get from them is really knowing what's going on with your baby, because that can give us meaningful information to change the course of action and support birth. This takes me into the next piece, which would be your baby's position. Your baby has sutures on the top of their head. They have a diamond in the front and a triangle in the back. So if your baby is on the cervix and the cervix is opening, a provider could go inside, they could feel the baby's sutures and they'll feel, oh, there's a diamond, baby is pointing in that direction. We can sometimes identify if there's a positioning issue that's making labor a little bit more complicated this way, or they can identify a positioning issue by looking at effacement. The next piece is dilation, which is what everyone wants to focus on. And so your cervix will open from 0 to 10 centimeters dilated. This is about 10 centimeters, and 0 is like you could insert a fingertip but can't get a full finger through. Dilation really doesn't mean very much. You could be 3 centimeters dilated and have your baby in 30 minutes, and I have seen that. I also saw a video not too long ago of a woman of color who got to the hospital, said she was in active labor. They checked her and said she was 3, so they couldn't admit her to care because she wasn't far along enough. And then she had her baby in the car 8 minutes later, which is horrifying and absolutely devastating. And this speaks to the flaw in the medical healthcare system, where we're focusing entirely on data rather than focusing on the full picture. But it's always better to look at the full picture, because not everyone's labor unfolds in alignment with a textbook. Labor is unpredictable, different for everyone, and there is no way to know when your labor will start, and there's no way to know when your baby will come. So it is an illusion to think that we can somehow predict or use dilation as a timeline guide, because we cannot. If someone at any point says that they're concerned that labor isn't progressing as fast as they want it to because of dilation alone, it might be good to step back and look at the full picture. Are contractions getting longer and stronger and closer together? Is the baby in a good position? Has the baby's station changed? Has effacement changed? Because dilation alone really doesn't give us that much information. Then there's effacement, and effacement is cervical thinning from 0 to 100%. So the cervix is about as long as my thumb, and as your baby descends and puts pressure on the cervix will not only open, but it will also thin. If there is a positioning issue, sometimes that can be identified with looking at effacement. Because if the cervix is effacing a little bit more on this side compared to the other side, that might be because baby is really favoring that side. And now we can do some things to open up the other side of your body, relieve tension, and encourage baby to move to a more even place. The side lying release, the spinning baby's 3 sisters of balance is a really great way to do this if there's ever any concern that there's a positioning issue. First time moms will efface first, and then they will dilate. Second time and beyond, moms will efface and dilate at the same time. So it's totally normal for a first time mom to maybe be checked by the provider and be told, oh, you're 2 centimeters dilated and 70% effaced. That is really encouraging information. You're 70% effaced. Yay! And the rest of dilation will soon follow, but it's important to emphasize the progress here. You're 70% effaced. When we focus entirely on dilation, sometimes we can get in our head, and that can be really discouraging. So instead, it's better to look at the full picture. What is baby's station? What is baby's position? What is your dilation? And what is effacement? Let's talk about cervical exams in pregnancy. Cervical exams in pregnancy are meant to identify dilation, effacement, station, and position, and are typically done routinely at 36 to 37 weeks and on, even though this is not an evidence-based practice. Some models of care, like the midwifery model, will only do an exam if there's a need to do an exam or the mother is curious. Other medical models, like the obstetric model, tends to do cervical exams routinely at 36 or 37 weeks on, even though there's no research to support that practice. Routine cervical exams in pregnancy or in labor do not improve outcomes for mothers or babies. The benefit to a cervical exam in pregnancy is that it could satisfy your curiosity, or it could give you meaningful information around induction. So if you're wanting to induce, it may be helpful to do a cervical exam just to understand what the baby's position is, what their station is, so that you can optimize your position to support baby's position, and to understand what induction tools might be available to you and how likely an induction is to work. There is something called a Bishop score. So a Bishop score is a score that can basically help assess if your cervix is in a place where it's favorable for labor, which basically means that it's more likely induction will work. If your Bishop score is lower and you try for an induction, it may be that the induction doesn't work. If it's higher, it's more likely the induction will work. Unfortunately, there's no way we can know. I remember having my cervix be long and closed and not very soft, and my baby was up high, and I went into labor a few days later. I also know women who are 5 centimeters dilated, and they didn't go into labor for days like that. They're just hanging out pregnant, 5 centimeters dilated. So it doesn't mean that much, but it can be a helpful tool. So a Bishop score basically assigns you points for different categories for what the provider is seeing with your cervix, and then you can tally up to 13 points. 13 points means it's very likely induction will work, and closer to 0 means it's less likely induction will work. They're looking for a dilation, effacement, and station. They're also looking for consistency, which means is your cervix soft, is it medium, or is it hard or firm? And they're looking for cervical position. Is your cervix posterior, pointed towards the back? Is your cervix more midline, coming towards the front? Or is your cervix anterior, pointed forward and easy to access? The cervix moves near the end of pregnancy, just like the cervix can move during our cycles. Essentially, a score of 5 or lower means your cervix isn't favorable for induction. A score of 6 to 7 means the readiness is mixed, and a score of 8 and above means it's more favorable. I like to teach my students really just to look at the full picture and understand kind of what's going on with their body, what's going on with baby when they're making that decision. A cervical exam can also help you identify what induction options are available to you, because certain mechanical induction methods where there is something that's inserted into the cervix or goes past the cervix usually needs to be a little bit open for those to even be a possibility. So this is how a cervical exam can be helpful and give us meaningful information around induction. Otherwise, is there any other benefit to a cervical exam in pregnancy? No, outside of maybe there's concern of preterm birth or something like that. Next, let's talk about cervical exams in labor. So if you are planning to birth in a hospital, you'll probably arrive at triage before you get your room. And when you're in triage, a triage nurse will likely ask you to do a cervical exam because they want to make sure that you are in active labor before they admit you, because they don't want to admit you too early. So active labor is defined by 6 centimeters dilation and above, but obviously that doesn't apply for everyone, because just like I said, there are people who were 3 centimeters dilated and had their babies within a half an hour, and I've seen that. And those people were in active labor. So when you arrive, you can choose to get the cervical exam, or you could choose to not get the cervical exam. It's up to you. If you decide you don't want the exam, you can just decline. And if they say, oh, but you have to get it because we don't know if you're actually in labor if you don't get it, or we can't admit you to care if you don't get it, you can say, I'm choosing no. The answer is no. I'm not changing my mind. You just say no in a different way again. It's just decline again. And your advocate can also step in. She said no, we're declining. With the EMTALA law, which is the law that applies to hospitals that bill Medicaid, the hospital has to stabilize you, which means if you go in labor, the way to stabilize you would be to have your baby and placenta be born. That stabilizes you. If you go in seeking care and they deny you care because you don't consent to a cervical exam, or because the cervical dilation isn't as far along as they want it to be, they could be facing an EMTALA violation, which poses significant consequences to the hospital. You also have the legal right to request or refuse treatment and testing. So no one can legally deny you care simply because you don't want a cervical exam. If you don't want an exam, you could offer an alternative. Could you time my contractions for a little bit and assess that I'm in an active labor pattern? That's a great alternative to explore. If you're not birthing in the hospital, depending on the midwife of your choosing, it may be that the midwife wants to do an exam to confirm that the baby's head is down, perhaps, or maybe they don't mind if they don't do any exams. It really depends on that provider, and it's important to talk about your preferences around exams with your provider before planning an out-of-hospital birth, just so you know what to expect in your care with them. Do you need any cervical exams in labor? The answer is no. Cervical exams are not necessary for your health and safety, but they can be helpful on a case-by-case basis. So what do routine cervical exams look like? Routine cervical exams means that we're giving you an exam upon admission every 3 to 4 hours, depending on where you're giving birth, and before pushing, when you start feeling pressure. They want to do an exam before pushing to make sure your cervix is fully open, and every 3 to 4 hours to assess progress. All of this is optional. It's really important that you understand that you have the right to say no to any cervical exam, and that you're only getting an exam if you're truly giving informed consent, which means you understand risks, benefits, and alternatives, and you understand that you can say no. I know plenty of moms who got no cervical exams throughout their whole labors and didn't need a single one. And I know other moms who received 10 cervical exams throughout their labor. Some moms are really curious and they want to know. Other moms just don't know that they can say no. So it's important you know you can say no. So what are the risks of cervical exams in pregnancy? Cervical exams in pregnancy can be uncomfortable. And this is because the cervix is sometimes pointed a little bit posterior or behind the baby. That means that as the baby starts to engage in the pelvis, the cervix might kind of move back behind the baby's head. So if a provider were to check for cervical dilation, they'd insert their fingers and they'd hit the baby's head before they could even access the cervix. And so they're running through the baby's head through the vaginal wall, and the cervix is just really far away, and they may even have to kind of walk their fingers along the bottom of the vaginal wall to try to pull the cervix forward and try to access it. This sometimes can be uncomfortable. Some moms find that cervical exams are uncomfortable. Other moms find that they don't mind them at all and they're not uncomfortable. So it really depends on you and the provider and the way the cervical exam is performed. I do not want you to ever experience anything that feels uncomfortable and sit through it. So if you're ever getting a cervical exam or getting a membrane sweep and halfway through you feel like, I hate this, I really don't like this, just say something. Wait, stop, I changed my mind. That doesn't feel good. When we have negative experiences with that part of our body in pregnancy, it may create some fear about having cervical exams in labor, or it may create a negative association. And we only want positive associations there, not negative ones. Another risk to a cervical exam is that it could break your water. This is very rare and more likely to happen if your provider were to give you a membrane sweep. We do have research, randomized control trials that showed that just doing a cervical exam didn't necessarily increase the likelihood for the water breaking before labor, but we have other randomized control trials that found that the group who got the cervical exams were having more situations of premature rupture of membranes where the water broke before they went into labor. And we don't know exactly why, but evidence-based birth says it's possible that the providers were performing membrane sweeps while they were doing the cervical exams. And a membrane sweep is when a provider takes a finger, puts it past the cervix, and sweeps just like this. And a sweeping motion moves the finger back and forth or even all around to try to separate the amniotic sac and the membrane from the cervix and lift it up. This releases prostaglandins, which are hormonal precursors to birth and can sometimes send someone into labor. In certain hospital cultures and hospital environments, it's common to have a provider offer a membrane sweep as part of your routine care, which is very interesting because membrane sweeping does not improve outcomes for people and it's not part of care. It's not necessary for your health or well-being. It is an intervention. It is an induction procedure that can potentially send you into labor. Membrane sweeping does increase the likelihood for breaking the water, and it is a risk factor for early GBS disease for newborns, likely because it can cause the water to break before labor. And if you have the GBS bacteria, which your provider will test you for at the end of pregnancy, it's a normal bacteria that some some moms have. If you do have it, it's very possible that if your water breaks, it could travel up to baby or baby would be exposed. It is very unlikely, but still a possibility, that baby could develop early GBS disease. 1 to 2% of babies will develop early GBS disease to a GBS positive mother without antibiotic treatment. With antibiotic treatment in labor, the risk is reduced to about 0.2%. So if you have GBS, avoiding membrane sweeps may be beneficial. But anytime you put anything past the cervix, there's always the possibility of breaking the water, even if that risk is low. Cervical exams can also be uncomfortable and they can be unwanted, and moms don't know that they can decline sometimes. Now let's talk about the benefits of getting a cervical exam in labor. Getting a cervical exam in labor is beneficial if it gives you meaningful information to change the course of action. So that means maybe we're noticing, oh, you're having a lot of pain in your back, or your contraction pattern has spaced out. It was 3 minutes apart and now it's like 5 or 6 minutes apart. What's going on? Maybe when you sit down on the birth ball, contractions are 3 minutes apart. When you stand up, they're 6 minutes apart. Something's going on. There isn't a lot of consistency here with the pattern. Or maybe you were having a consistent pattern and now all of a sudden it seems like labor is kind of stalling and your contractions are really spacing out or becoming less intense. Your baby's position can impact this because when the baby is well applied to the cervix, that stimulation from the baby's head pushing down sends a signal to the brain to release oxytocin in spurts, which gives you a consistent contraction pattern. If your baby's on your cervix this way, or they're just not really well applied to the cervix, that lack of consistent application to the inside of the cervix may impact the signal, which impacts your contraction pattern. Maybe you sit on the birth ball and that helps baby engage and put more pressure on the cervix. Now contractions are 3 minutes apart, but baby's having a hard time staying well applied to the cervix in other positions. So if you stand up, now they're no longer well applied to the cervix. So this is one of the best reasons to get a cervical exam in labor. Are we concerned about a positioning issue? Concerned about progress? Let's see what's going on with baby's position and station. Oh, we find out that maybe baby is OP, or facing forward. This is a variation of normal that can sometimes cause some challenges, other times it doesn't. It's nothing to be afraid of. But if baby is OP and we're noticing there's some challenges with the contraction pattern, now we know what's going on. And if you're in my coaching program, you will learn how to support adjusting baby's position if we identify that baby is OP, or asynclitic, or any other positioning challenge that could arise. And if we know what's going on, then we know what to do and how to resolve that position by changing your position. Another benefit to a cervical exam is that it satisfies your curiosity. And that's about it. So cervical exams are helpful if they give us meaningful information to change the course of action, or if they satisfy your curiosity. Also, a cervical exam may be helpful if, let's say, you start feeling pressure and then the baby's heart rate really drops and we're going, oh no, what's going on with the baby, and everyone's panicking. Maybe if we do an exam and find out, oh, the baby's right there at the perineum, that's why the heart rate dropped, because they moved down and they're about to be born, because sometimes that can happen. The risk to a cervical exam is that during labor, if your water is broken, they can increase the risk for infection. This is very serious. And so it's important to be very deliberate about our cervical exam use if your water is broken. Research says that you have up to 5 cervical exams after the water is broken. After 5 exams, the risk for infection really increases. It does increase with each exam, but only a little bit. After 5, it increases quite significantly. But this isn't just a cervical exam, it's anything going in your body. So internal monitoring, manually adjusting the baby, a test to see if your water is broken, like a swab going in the body. All of this can increase the risk for infection. So it's important to limit those things for when they're actually necessary, rather than getting routine exams if with the routine exam path it's looking like we're going to go beyond 5. But ultimately the choice is yours to make. Another risk to an exam is that it could cause you to get in your head and could cause doubt and frustration or feeling like you can't do it. Discouragement. So if someone says you're 4 centimeters, or maybe you're only 4, or maybe you're 4, which means you're going to be in labor for 6 more hours, all of that is really unhelpful and also not true. We have no idea how long it will take for you to have your baby. So you could indicate in your birth plan that you don't want them to tell you the number. You can also say that you want them to use encouraging language. Another risk would be that you're in your rhythm and you're focusing. Coping with labor is about focus. And now all of a sudden people come in, they want you to get on your back and do an exam and stop what you're doing and then have a conversation with you about what's going on. That can really throw you off your rhythm. And if you're being interrupted frequently throughout labor to do exams, this could maybe make it harder to have an unmedicated birth. Cervical exams are often less uncomfortable in labor because the cervix starts to soften and move in front of the baby's head and open. But that being said, they still can be uncomfortable. Sometimes they are unwanted, and sometimes moms don't know that they can say no. So just because you're giving birth to a baby does not mean anyone has the right to put their fingers in your vagina. If anyone doesn't respect your choice to say no, you can always say, I said no. That was my choice. I'm not changing my mind. Right? So we're using the broken record tool. Just keep saying no, decline again. You can also request a cervical exam if at any point you're curious and you want to know, and you do have the right to know what's going on with your cervix and your baby. If a provider ever comes in and tries to do an exam without asking you first, just know as an advocate, you can always say, wait, stop, what are you doing? Oh, you're gonna do an exam? Oh, Sarah, are you okay with that? So we're inviting the mom to give consent. If a mom says, oh, whatever, fine, I'll do it, that's not consent. Consent is yes. No one should ever perform a procedure or a test on your body. No one should put their fingers in your vagina without you saying, yes, I consent to that. My private coaching clients have outcomes 9 times better than the national average when it comes to avoiding tearing, cesarean, and epidurals. Click the link below to join my free Peaceful Birth Academy, where you can access the same 5-step process that they used to get these results. If you're already in my academy, click the link below to book a free birth breakthrough session with me. I'll clarify the steps needed for you to feel confident and prepared for birth and explore how I can support you inside the coaching program. You've got this.